Hi, Dr. Tracy Tyson from Vermont here to discuss some common misinformation about how your pediatrician is paid when they give your child vaccinations. Every state is a little bit different, so I can speak specifically to Vermont. I also practice in Florida, so I have a little bit of information about that. But in the state of Vermont, we have a universal vaccine program, meaning that insurance companies and the state buy up vaccinations for anyone who wants them, and then they are given at no charge to pediatrician offices. We administer them to patients at no cost. So at no time do I receive any money or quote kickbacks or anything for giving your child a vaccination. That doesn't happen in any state, to be honest. The only thing that does happen is if you don't have a state that has a universal vaccine program. Like in my previous practice in Florida, we went out, bought vaccinations from different companies. We went and researched. We found who had the best prices for the vaccines that we needed to give. We bought those vaccinations and then we charged patients exactly what we bought them for, and a slight administration fee, which was usually not even always paid for by insurance, just so that the nurse giving it, there was some fee for that. So we did not make any money at all from vaccinations in my practice in Florida either. And there aren't any practitioners that make money from giving vaccinations. If anything, some very small pediatric practices that are up and coming actually sometimes don't provide vaccinations because they can't afford the upfront cost. Because like in my practice in Florida, we would spend $60,000 to $80,000 in 1 month prior to school starting when we knew there was a bunch of vaccines that were going to be given, and then we had to wait 3 to 4 months for those to get reimbursed. And there's a lot of practices that don't have the money for that. So it is not true. It is 100% misinformation, actually disinformation, because it's being disingenuous that pediatricians are making money off of giving vaccinations. I cannot take money from a pharmaceutical company. I can take information. I can take a meal while I am getting information on a vaccination, but I cannot take any incentives. There is even a cap on if I can get a pin that has the name of a pharmaceutical company on there. And so it is very, very, very specific what we can take. And that is for very good reason. That is to protect medical integrity. And there are no pediatricians that would want it any other way. I hope this helps. Take care.